Hey guys, John Faulkner here at Survival Dispatch, and it's Tuesday. I know it's a little bit off schedule. We usually do Thursdays or Friday live, but we want to do a Tuesday special for you. I got two of my favorite people in the world. They're with me in spirit today. So I got Nikki in the studio with me, and for those that can't see, he's more than 6 feet, so there's social distancing here.
Not all.
So, and then I got Chris Weatherman. He's in his bunker, and Charlie Hogwood. So we are here to talk about. It's been 10, 12 days since we last did a live on COVID-19. So we just kind of wanted to talk about a little bit and answer any other questions. So if you guys got any other questions out there, feel free to leave them in the comments. Allie's on the back end. She'll be posting them up so that we can read them. I'll be reading them all for you guys, and the three of us will start to break them down. So first of all, as far as it goes here, guys, how's it going? So I'm in North Central Florida. Chris is in what do they call it? Central Florida?
Central Florida.
Central Florida. And Charlie's up, north, what do you say, northeast?
North Georgia.
North Georgia. So we're spanning here about 700 miles or so total. Yeah, somewhere around there. Yep. So, that's my Google Map estimation, about 700 miles. So, we can get a little bit different feel for kind of how supply chains are. And as always, like I said, leave your comments below. And also leave comments with how things are in your area. Just kind of, you can put your state or your city and state. And kind of supply issues that you're seeing, albeit food, supplies, cleaning supplies, sanitationary things, stuff like that. So you can leave those in the comments, and you guys can expand upon it as well. So, Charlie, what's the latest? What you thinking?
I know that.
So since we've met, unemployment numbers came out and went through the roof.
Unemployment has gone through the roof. The message is as mixed up as ever.
Yeah.
My prediction of everybody should have started out this mess wearing a mask. Now they're officially saying wear a mask.
Yeah.
I would say that almost everything that I've predicted so far has come to fruition. We're still seeing spotty supply chain stuff like we were just talking about.
Right.
We've got hospitals I've got some message from some nurses out of New York just a few minutes ago. Independent of the government operations, they are building field hospitals. The city of New York has announced that they're going to start burying people in the park temporarily because they are overloaded with the morgues. So they're running into that. I'm waiting to get some information out of India because I think that is going to be a total humanitarian disaster through starvation. Africa with their locust issues starting to feel the virus now. Central America is starting to feel it. Some of the stuff I said look out for is all happening. So I think we're really seeing a lot of that. Locally, grocery stores are thinning out. People are going online to do most of their shopping.
Yep.
We had an online ship shopper came and dropped off some fresh milk for us today because we got to keep the baby going with that. And he's like, I don't understand what's going on. People are spraying their groceries with Lysol. I said, well, I'm about to do that too.
Yeah.
And I had to explain it to him. And he's like, well, now I'm scared to even go to work. Thanks. So
Good job. Way to spread the holiday spirit. Good job. So, yeah. Chris, what's going on in your neck of the woods?
Well, I haven't left here a whole lot.
Yeah.
Because I don't need to. Not out of fear. And see, I'm not on the everybody needs to wear a mask bandwagon.
Yeah.
Number one, nobody has the appropriate mask to wear. And the something is better than nothing mentality, I don't subscribe to either because it's not better than nothing. It's like saying I will filter my water through this handkerchief and it'll be safe to drink. That shit doesn't work. If your face mask cannot filter down to 0.01 micron, you're wasting your time. Yeah. So I don't bother with it. I don't wear a mask when I do go in public. I do have a hand sanitizing product that I'm currently using. I'm trying to get my hands on more of it so I can share it with folks because it is amazing. But other than that, we're just here. I'm working on ham radio stuff.
We heard it beep in there.
Huh?
We heard it beep in there.
Yeah, I killed the power supply,
Yeah.
so I think would shut up. But yeah, other than that, I'm just working on books here, following what's happening. I'm following some threads that are
Sure.
a little disturbing, but not anything I'm going to talk about yet until I can
And
get a little more into them.
and that's part of why we wanted to put this out there. Is it's one of those things where I think people could get real relaxed in the next week or two, and just think that they can't get sunburned at this point. It's one of those things where because we've been in it now for, it seems like 5 years, but it's been about a month now. And it's one of those things where, listen, people are trying to, even the president is trying to make the best out of a bad situation. That's what he's trying to do. But at the same time, it's one of those things where it can start to sound like they said for the first day, like New York actually started to flatten just a little bit as far as positive tests were going. So it sounds like fantastic news. Just because it's flattened doesn't mean that there's nothing to be concerned about anymore. It just means that we almost have control on it. So,
we may not.
Right, that's what I'm saying. Almost
if
have
you go
control.
back and look at the Spanish flu, the second wave killed people than the first did. And there's models out there now predicting that this may have a third and fourth wave.
Right.
So this could go on for a very long time.
Yeah.
Sadly, I hate to say that. However, I believe the government reaction to it is out of proportion and wrong. This whole just let's kill the economy and shut everything down.
Yeah.
There's a small segment of society that really does need to be isolated. Most people that get it are sick and miserable, like the flu, and they come out of it. But those with comorbidities, of course, they need to be watched.
Right.
And then there's just folks that genetically they're more susceptible to this disease. But I think this whole keep everybody at home, shut all the businesses down, personally, wrong idea in my opinion.
Yeah, I agree. And
$2 trillion. I mean, good grief, that's our GDP. I mean, it's absurd.
And I will say, guys, we're going to try to give you guys as much of our advice as possible. None of this is legal or medical advice. We are not trained professionals. We're just giving you the information as it's presented to us in our opinion on the information and the stats about it. Chris, you were talking a little bit about masks, and listen, people fall on different sides, and that's one of the things about Survival Dispatch. When we set out to build it, I wanted it to be multiple opinions, multiple different looks at how to solve problems. And there's people that, I like Chevy trucks, Chris likes Ford trucks. It's just difference of opinion. But how we load those trucks are kind of the same way. So Chris, talking about masks, Charlie talking about masks. Donald has a question here. Do you think there are effective ways to make homemade face masks?
No, personally.
Charlie?
I'll show you mine. I made one as a sample. Hang on, I'm gonna get it. I'll be back.
Yeah, all right. Charlie?
So here's the thing. There is a theory called low inoculum. And it's okay for us to disagree a little bit, and Chris and I will go back and forth a little, and that's cool, and we're good at that. But there's a thing called low inoculum. I don't agree with telling people to wear a bandana. I think that's just not enough. It's too gauzy.
Yeah.
But I think if you wore a mask or you wore something thicker that's going to help to restrict the particulates that are going into your system, that is better than taking a full load of inoculum. So
right.
what that really means is I might be able to build up a resistance to it, and that's a scientific theory that I think they're going with in telling people to wear a mask so they don't buy all the other masks.
Yeah, I agree, and and I think it's one of those things where I'm going to split the hair here. I think government agencies, whoever it might be, saying, hey, something is better than nothing. I think it's trying to put, let's quasi say, a Band-Aid on a gunshot wound. Is a bandana across your mouth better than anything? Yeah. But we also said that, giving high fives with our elbows was the greatest thing until they realized that everybody was coughing and sneezing into their elbow and then, hitting the next person's elbow. So, things constantly are changing. And here's what we're going to do. Nikki's going to put up a couple numbers. Which one are you going to put up, Nikki?
I got the world overview first from John.
All right, so the world overview, this has come from Johns Hopkins University. We use this as we use it here as like a benchmark because it's pretty up to date. They update it every single day, and it's pretty reliable. So, as you can see, the U.S. has now almost got 3 times the amount of confirmed cases over the next country, which is Spain. Guys, is this because we have more people that are sick or because we're running more tests than any country?
Well, we're a different country. And if the real numbers are up there, China would far surpass us.
Right.
We know that their numbers are blatant BS.
Right.
We're a different society. We're a more mobile society than a lot of the other ones, And we're also not nearly as, what's the word I'm looking for?
We don't listen?
Yeah, we don't behave
self-dependent,
well, okay?
self-independent, yeah.
With that rugged individualism of the American, experience and stuff. We're not like other countries where, when they're told, "Hey, guys, look, this is what you got to do," everybody kind of goes and does it. Here, everybody's like, whatever, and they're not paying attention. And two, we have some very, very large cities, so that are densely packed, and that's where we're seeing this. I mean, New York's 40% of all cases in the country. New Orleans is now like on fire. I'm hearing some horror stories coming out of New Orleans.
And the people in New Orleans were the same people that were spring breakers are like, this is not going to be that big a deal. I'm going to Mardi Gras.
Right.
And now look what's happened. So the problem is if you do go out, even though you're not getting it and not getting a bad case of it, you're still spreading it to everybody else.
Yeah.
I'm part of my county's pandemic response team. I have a meeting tomorrow morning. We're doing conference calls now, and I'll give you what I'm getting from the inside of the mechanics of how things are really running. The Department of Health website is a week to 10 days behind on reporting the numbers on the public websites.
Okay.
So whatever you see is not accurate.
It's got a lag. It's got a lag of 7 to 10 days.
You've got tens of thousands of tests that they're backed up on. Right. That's where their focus is. We are way behind on testing, so the cases are a lot worse than what you're hearing. And none of it's conspiracy. These are just the facts that I'm getting from dealing with the health department, with our community leaders, with the stakeholders, FEMA, emergency management, and all that. Is the only thing that is slowing anything down is people staying home. So they send DNR out. They're breaking up parties on the lake. Their boats are hiding in the coves now. The weather's warm. People are getting out. And they have to keep shutting all this stuff down because people are not listening. And so the numbers that you're hearing are wrong. They've dispatched the National Guard to all of our long-term care facilities in the state, not as security, but as to help clean because they are all hot zones. They call them hot pockets. So that's the problem that we're having. We've got so many firefighters and police that are out sick. New York has got, as of yesterday, 10,000 police and firefighters out, and burglaries are up 75%.
Right.
So, I mean, that's kind of a big deal.
But you had the governor of Houston come out and say, "Come on, criminals, can't you just take a break?" Did you guys see that? Did you guys see that? Come on, criminals. Criminals, if you guys are out there watching our video, take a break. Help us out.
Give us a rest.
Throw us a bone.
Come on. Come on.
Yeah. So, and that's the problem is we're transitioning a little bit. We're transitioning to the fear and panic of this illness because people aren't getting it.
Yeah.
The ones that are getting sick are not out there online on social media saying, "Oh, I feel terrible." They're actually homesick, So you're only hearing the people that are like, "Well, let's don't worry about this. It's not that big of a deal."
Right.
They're the ones with a voice right now. But I'm telling you, behind the scenes, I got neighbors, nurses that are telling that the hospitals, the way that they're dealing with it now, what they are facing, that they only get one mask for the entire day.
Yeah.
I've got, we're feeding thousands of kids through food insecurity now because they don't have any food. We're looking at setting up pandemic quarantine sites publicly. We're looking at we already, because we don't have enough firefighters and stuff, they've relaxed the laws on who can drive an ambulance.
Right.
Now, anybody who's a law enforcement or a firefighter, anybody can drive the ambulance as long as there's at least one EMT in the back. And they're dedicating ambulances just to infected people.
Yeah.
This is not just the flu. And the people that keep saying it are just underinformed, because this is in addition, it's different to it.
Yeah.
Because I'm seeing
definitely
the
not
side of it. There are, some people aren't getting it very bad. But if I act like I don't get it and I go out in public and I might just pass it off to somebody else, and now grandma dies, somebody else's grandma dies. So let's just give it a rest and, try to move forward and get this economy back on track. Because the longer we do this, the longer we're shut down, the bigger chance we have on a second wave, and the more trouble we're going to all be in. And we've already got people that are starting right now.
We're like, what, 2 weeks from the peak nationwide? Isn't that where we're at right now, about 2 weeks out from the peak?
Well, estimated somewhere in the 2 to 3 week range at this point.
Yeah, around the end of the year, or around the end of the month, 1st of May was where they were predicting the plateau. So, all right, Chuck wants to know, how do you all think we will transition back to somewhat normal lives after this or through this?
I think a lot of stuff is going to change. We have to figure out now, what are the triggers what are the milestones that we can reach that will say, okay, now it's okay to send people back to work.
Yeah, school.
You've got to have a sustained drop in cases, right? You got to have a reduction of people needing intensive care and ventilator space. You've got to have the hospitals get back to a capability to handle all of their public requirements, not just be inundated with people walking in thinking they have this particular virus. And you've got to then get people that are back into their workspaces.
Right.
And there's been a lot of really scary talk about how we're going to do that with bio passports and all kinds of, take your temperature every day. And that stuff, that gets a little on the, that's where we're going to have the long-term changes. There's a lot of cell phone tracking discussion going on at the government level. If you've had it, have you got your immunity up? Are you contagious? After 48 hours, and it's been officially put out to us, even though you've had it, may have had a light case of it, and after all of your symptoms are gone, for at least 48 hours beyond that point, you are still contagious to everybody else around you.
Yeah.
That's the problem with this, is nobody knows who's got it.
Yeah, I've heard some talk, Charlie, of like vaccination cards or immunity cards or things like that. Like you're talking about becoming a thing, and to me, that's getting into the Orwellian aspect of stuff.
Very much so. Yeah, absolutely, very much so. There's a lot of different bio tags that they're talking about doing, and I think I hate to get into the conspiracy side, but I think that some of those things are probably going to come to fruition, and when it comes to some of the tracking, contact tracing, and so forth that they got to do.
Yeah, and
know where you're at.
And Zach from Syracuse, New York, wants to know what big changes do you expect to come from this? And that's part of it. It's trying to figure out, more tracking, like Charlie was talking about. There's going to probably be, some more regulations based on who can do what, where, and when. And it's going to just be things like that. Nick, you got anything you want to pipe in on here?
No, it's just going to be interesting to see how they use this in as far as surveillance and security. How they loop back into, well, now we have a reason why it's helping you.
Right.
Not just coming out of the blue saying, oh, now we need to track everything to the nth degree.
Yeah.
We're helping you. We're helping to partner with it. So it'll be interesting to see how that kind of falls into place with it too.
Yeah, and Christine wants to know, she said, what is your view on stopping the hiking on the AT? Further details, why all the trailheads had to be stopped as far as the access points. I'll tell you guys, Christine, I hiked the AT trail. I know a lot of people that were actually on it because the season just started for through hikers heading from south to north. A lot of them were upset that they had to come off the trail because it's something that you have to plan a year or years in advance, save up money, get the resources all set up and secured. It's a lot of logistics that go into it also, as far as drop points and where you're sleeping and how many miles you're trying to do. But the biggest thing is I think and a lot of people are saying, like, why are you taking people off the trails? They're out in the middle of nowhere. They're not going to, infect people. I think the biggest reason they shut down the Appalachian Trail, some of the reports and stuff I've heard, they were afraid that people were going to get sick on the trail. And it takes a lot of human resources to get somebody off the trail. Like if one hiker got to the point that he could not hike anymore and they had to get him to town to a medical facility, it's usually 4 guys that it takes to carry him out on the trail, or a helicopter or something like that.
And that's a thin margin for men.
Right. But
especially in that terrain.
But I mean, that's just, it's thin, just to get 4 guys, put them on a stretcher and carry them, maybe a couple miles to a road or something like that. It's a lot of resources that they would have to commit to that, where the easier part is just don't let it go. I mean, I don't know how it is where you guys are. We have some wildlife preserves and stuff that have nice hiking trails. They shut them all down. I don't exactly know why. I mean, you're talking like 5 to 10 mile loops. It's not much. You hike them in an hour or so, 2 hours. I don't know why they closed those down, but the AT trail, it's so big. Also, you then get a lot of out-of-state transients as well that you're trying to do medical care for as well. So, Charlie, any more thoughts on that one?
Yeah, because I'm at the entrance to the southern end of the AT here. Yep. We did that search mission just not that long ago, and I can tell you that some of that terrain, the word treacherous is very, accurate. So I think you're 100% right that part of that is trying to dedicate resources to get people off the trail. The speed that people can become sick, try to walk it out and say, I'll be fine. And from the point that they go from being fine to not fine, and then trying to locate them on the trail, trying to get somebody in there and get them back out is the problem. But it's not just that. While you might be solo hiking, right now so many people get on the trail and they're walking right past each other.
Yeah.
Right? So you got traffic coming and going. They stop and they gather and they talk, or they cook something up, or they gather in the parking lots.
Yeah.
And they all around the cars, and everybody's
or you're at a shelter for the night.
So you've got a lot of things, and then if you hop off the trail to get supplies, now you're taking your potential issue into the next community.
Yeah.
So they've had to shut down a lot of these things because people were just getting so cabin crazy. They're going to all the parks, they're on the lakes, and they're shutting down the lakes now because people are rafting boats together and throwing cake parties just to get out of the house. So that's where we're at.
Yeah, and Candy has a question here. If everybody wore a mask, wouldn't that be like double masking?
Yeah, absolutely. If you got people that are not, there's a video out there. One of the Chris Martinson, I think he highlighted it. When we talk, we spittle.
Yep.
I mean, some of us more than others. I've been out with you guys. I know.
Hey.
But as you talk, you spittle, and as you do that, the particulates in stable air can float for about up to 3 hours. In more disrupted air, they fall, and they fall on the surfaces. So that is happening all around your personal space, and then that's why we can't have people out doing that, because that stuff gets in the air. You're getting it. So if you cover your face with the mask, you're preventing the spittle. And if you put your mask on, the other person is not getting what else is floating and coming in too.
Right.
So
Charlie just likes saying spittle.
It's also your eyes.
Yeah.
Because if you get it in your eyes, it's the same thing.
Yeah.
So got to wear some kind of glasses.
All right, Chris. Brian says, I bought some Honeywell Elite Aerogen air filters, FPR10, that's supposed to filter out virus carriers. Can I use these to create a face mask or enhance my dust mask? This has been a thing that's been going around. A lot of people are trying to take like vacuum HEPA filters and things like that and cut them apart. Thoughts?
Yeah, I mean, anything that has a smaller micron. I mean, think of it like our water filters, guys. When we talk about filtering water, we need a water filter that's good down to 0.01 microns, and that's for what? To filter out viruses. Okay, yeah. So that's really the threshold to prevent a virus from you inhaling a virus. Now, the reason I say the homemade masks are no good and stuff is because of that. Now, Charlie's points are very valid. Of if you're wearing one, you're not aspirating stuff into the air, and you have less chance of inhaling things, but the virus can still get through there. Now, if you have something with a lower micron, filtering capacity, then of course it's going to be better than the dust mask itself, because the dust mask you buy at Home Depot is about a 2.5 micron filter. It's 2.5, and you're looking at COVID being a 0.01. So, you see why I'm saying those things are just not that effective.
Yeah.
So if you can add something to it that takes that 2.5 down to, a negative, then you're doing better.
And I'll expand on that a little bit. You see a lot of bug out bag, videos and stuff on YouTube, and people will throw paper masks in there. Those are for like dust particulates. So if you were to come across something like 9/11, where there's just debris and ash and things like that just completely filling the air, instead of breathing that in, it's the same with bandanas. That we're trying to get out those dust and smoke particulates, like Chris said, maybe down to 1 micron, but not 0.1. Like it's a huge difference. So,
yes.
But a lot of HEPA filters, people are trying them. Something's better than nothing. So if you can go with it, go with it. So Alex says, thoughts on recent CDC guidance telling hospitals and et cetera to report deaths as COVID, even if it's only assumed to be, but is unverified and unconfirmed. Have you guys heard anything on this?
It's opposite of some of that in my experience, because without it, so let's take one step back. In New York City, 20 to 25 people die in their homes every single day. That's at their home death. Right now, there's 200 to 250 dying every single day in their homes. So if they had a positive test prior to that being at home, and they knew that they had the COVID-19, then they can now relate that and chalk that up under the COVID-19 cause of death. If they died even from COVID-19 but did not have a test prior to death, they will not now do a test post-mortem because they don't have enough tests to do that. So they can't officially put it in the COVID-19 column. They put it down as respiratory distress, cardiac, whatever else they suspect it might be, and then they move on. So the numbers are not accurate from that perspective, and you're not getting that information out of the health department system. And frankly, at this point, it doesn't even matter anymore what it is. We're already the world leader, gold medal, first place, for infections. And
China is.
Well, China is.
Yeah.
But
that's a different
China
story.
Doesn't want
That's
gold medal, so they're fudging their numbers a little bit.
22 million cell phone users disappeared in China. That's a pretty damn good indication.
So here's the thing.
Hey, they're taking a sabbatical, okay? And they're just getting rid of electronics for a little bit. Those wave things.
I'll play a very short devil's advocate. So you've got, yes, a lot of people came offline. You also have a censorship society that sees an actual picture of your cell phone screen all across these big Brother monitors. Yep. And if you look on, you'll see some of those. You can look it up. And they watch in live time all these phones going through all of their different messaging apps. And if the monitors that see that, pick that up, they can shut your phone off. They can go visit you at your house and tell you to stop doing that kind of thing. And so those phones will come off the line. So yes, some people are dying. Some people are being censored and shut down. Some people have lost their jobs and can't afford the luxury of a cell phone any longer. So it's going to be a mix of a lot of stuff. Was it 22 million people that were dead because of the disease? I don't think it would be that much, because, as money and funds you start shutting down your luxury items, and a cell phone to many people is, I can't eat that, so I'd rather buy food. So but
even if it's 10%, which is the number I'm kind of working off of, that 10% of those are deaths, that's still 2 million.
Still 2 million.
It's a very large number, and I don't think anybody disagrees with the total number of people that have been swept under the rug. I just read an article before, as we were coming on, about the incinerators, and they were people that they can't save anymore from the hospitals is being zipped in bags and tossed in the oven. And it's a very sad.
I had one of my readers contact me, and her daughter was living in China teaching English to physicians. And they came to her house and took her temperature. She had a fever, and she said the last thing she heard from her daughter is that they were dragging her away. Yeah. She never heard from her again.
Yeah, absolutely.
All right,
it's an ugly situation.
Next question here. Do you guys think hospitals are venting patients too early when they don't actually need it?
No, I've talked to some doctors about that, and if you don't do it fast enough, then you're going to waste a ventilator by even putting them on it. The way that this attacks the lungs, and it's odd that it represents the same way every time.
Yeah.
It starts in the lower lobe of the right lung, and then it begins the process. And if they don't vent them fast enough, their O2 sats fall so low that you get into organ damage territory. You can't push fluids on them like you do a typical pneumonia patient because that exacerbates the COVID. You can't use the typical drugs that you use to assist a person on a ventilator because of COVID, because that exacerbates it.
Right.
So you look at patients who are getting dehydrated because they have to be, which then puts them into renal failure areas. Then you start seeing the cytokine storm thing start, which affects the liver. Now they've got liver damage, other organ damage, and the process of this virus killing you is actually pretty damn awful.
Yeah.
From some of the doctors that I'm talking to and some of the stuff I'm reading. I talked to a trauma nurse the other day that he's taken care of 9 COVID patients so far. And he said 2 of them died and some were still on ventilators, and he had 2 that had come out of the hospital out of 9.
Right.
So.
Okay. All right. Christine wants to know, does it make sense that prisons are being emptied and we are ordered to self-quarantine?
Well, you got to look at who they're letting go.
Yeah.
Low-level offenders. If you're in jail because you had traffic tickets or you didn't pay child support, which you should pay your child support, but are you a real threat to society? If you're there because you got caught with a sack of weed in Texas, are you a real threat to society? No. And those people are requiring resources, inside the facility. There's the argument that, well, keep them in there because, they're protected. They're in there. Well, no, they're not protected while they're in there because the staff rotates in and out every day, at least twice a day. The food coming in and out, there's the people making deliveries. So the potential for it getting in the facility is high. And if it does, that's another hot pocket.
Yeah.
Like Charlie was talking.
Yeah.
So let these low-level offenders out is a smart thing for them to do. It takes the burden off of them. Now, law enforcement coming out and making announcements that they're no longer going to make arrests for misdemeanor crimes was one of the dumbest things I've ever seen.
Agreed.
They should have internally decided that, but not friggin'
announced it publicly. Yeah.
Yeah. But yeah, it does make sense to let these people go. I mean, most of these, it's very easy in this country to find your way into jail. I worked in them for years. Trust me. I've met some folks in jails, and I was like, what the hell are you doing here and why? And they would tell me, I'd be like, you're shitting me. So, yeah, to me, it does make sense. They have a better chance on the outside than they do on the inside.
Yeah. Palm Course Prepper wants to know, do you guys think this is a short-term or long-term issue financially?
Very long-term. Very long-term.
I agree. And and Charlie and I, we all kind of said it in our last issue, for every week that we go into this, it's 4 to 6 weeks on the back end to help to try to recover. Would you still agree with that, or you think that number's even gotten longer?
I think we're longer than that to try to get out of this.
I think that we're going to see a gradual reopening of different areas around the planet, but I think that we are going to have areas that might be labeled as high risk that are going to be shut down on and off over time. So it depends. I think they're trying to figure out how to open up certain areas. And until the viral load comes back up in an area, and you get confidence in it, then maybe they'll leave it open. But our county is actually, because the numbers are so off from the health department, they're going to the doctor's offices and they're polling doctors and asking them for what cases they have, because the health department isn't communicating. When you live in another county and you work in this county, they don't let this county know that you're sick. So they can't open up different areas confidently. So you're going to have that kind of problem.
Do you guys see, next question here, do you guys foresee future supply issues with fresh fruit, vegetables, since the workforce that's in the field is not working right now?
Yes.
There are going to be major food disruptions coming. I mean, the 3 major meat packers are all closed down. There's dairies dumping hundreds of thousands of gallons of milk down drains and into fields. The vegetable packers aren't packing, you know.
And the offshore vegetables aren't coming in. So
fresh vegetables aren't. Well, I was just told by somebody a minute ago that there's a very large produce facility in New Orleans, in the port down there, where fresh produce comes in, like from South America and stuff, and it's a big refrigerated facility, and it's empty. And so FEMA, I guess, just made a deal with those guys to start using that facility as a morgue. So it was holding fresh produce. Now it's holding bodies in New Orleans. We are about to see major food issues here in a matter of weeks.
Also got food nationalism, which was announced last week, that various countries now are so concerned about their own population that the net importers of food are not sending out what they normally would, because they need to keep it for their people, because they normally import it.
Right.
So India.
You mean the net exporters?
You got net importers that bring in more than they ship out.
Yes.
Are keeping what they little they were shipping out for their own people. Like, we're a net exporter for food here. Right now, we can still ship stuff out, but other countries around the world are saying, well, hey, we better keep some of this food here because we got people out of work and we got to figure out how we're going to solve this problem.
Right.
India shut down the whole tea crop for India. Sounds like it's lost for the year. And all the migrant workers in India are now walking hundreds of miles home. So you have that not just for tea, but you've got it for vegetables. You've got it here when you have migrants that come seasonally into the United States to pick the vegetables, live in houses with a lot of them all in the same place. They ride in the cars to the same, fully packed cars, so they can't social distance, which now shuts down an entire farm, and all the picking operations. And and we're coming out of one crop, we got to get into the next crop. If the next crop doesn't get planted, where are we going to be next fall?
Right.
Or the coming fall?
Right.
So,
and then you start entering winter where nothing's going to grow.
Yeah, absolutely.
Yep.
Absolutely. So as soon as this started, I started ramping up every level of my food storage. I'm now growing stuff. I've made contact with rabbit breeders to get rabbits again, because just to be safe, if nothing happens, I'm going to have,
if nothing happens, you have food to eat.
Yeah, we've increased our chickens garden space, and I'm actually considering bringing goats in, which I hate goats.
I do too.
Okay.
But I'm presently actually considering bringing some in because I've got a friend with a substantial goat herd. Alan Kay, a lot of you guys know him. He's currently building his goat flock pretty substantially, and that dude has got a homestead that most people would dream of at the moment. So the food is seriously going to become an issue here very soon.
Yeah.
The workers aren't being allowed into plants. And then there was one plant that was still operating, one of the Purdue plants, I think it was, that the workers went on strike saying they didn't have PPE, so they wouldn't go in. And I'm texting here with a friend of mine who's on the NYPD. And I asked him, I said, how's the city? And his simple reply was, shit. He said, the natives are getting restless. There were 3 homicides yesterday. He said, nobody is listening to social distancing. Commercial burglaries are through the roof, and so are home invasion robberies. That's New York City.
Tell him I said hey.
He's watching.
Yeah.
He's watching. You tell him.
Oh, howdy. Saying, hey, Brant told me to tell you both hey.
Howdy.
I just did a podcast with him earlier.
All right. Montez wants to know, should you have any, when attempting to create a homemade face mask, should you worry about any of the filters? As far as the fibers that the filters are made out of getting into your lungs and causing irritation and things like that?
If you make the mask properly, you shouldn't have that problem. If you're using a good dense cloth lining around your filter, I don't think you'll have a problem with that.
At least on the inside.
On the inside part, yeah.
Clang wants to know, does COVID hinder oxygen absorption in the hemoglobin, keeping the blood from adequately, sorry, it has to go up. There we go. Producing the body and damaging the Ebola in the lungs?
Yes. Well, it prevents the
damage
oxygen from getting into your lungs. And one of the initial symptoms, so if you're at home and you have, if you've got a pulse oximeter, you can get a little one that you put on the tip of your finger. One of the early signs is if your O2 levels begin to drop below, I think it's 95, then that's a clue that you're not processing enough oxygen from your lungs. There you go. Into your system.
Yep.
So we should all have those anyway. I do over here on the shelf, but that's the kind of thing that tells you if your body's processing the O2 that you need to keep going.
Yep.
So the other way to look is if your lips start turning blue, that's a clue too.
Your fingertips,
Yep.
Fingernails.
So right now sitting here, I'm at a 99 O2 set. So 98 is an average for someone who's up.
Hey, Chris, you're a 100 in my book, bud. You're a 100 in my book.
But when you start dropping, like he said, down to 95, that's an issue. When you get down into 90, like you're starting again, you're looking at organ damage range, and you'll feel it in your body. You won't have the gas you used to have.
Joe,
because I watched my dad go through this and pass away from it. It's not COVID, but a lung issue. So.
Joe wants to know, after this pandemic is over, how much of an increase in the prepping community do you foresee?
I see a boom in the prepping community.
I think you'll see, listen, I always call it the firework model. You'll see a huge boom. It's going to go up in the air and it's going to explode and it's going to look all pretty, and then it kind of fizzles out and it's just dark again, period. We see it all the time. Listen, guys, I am telling you right now, from Maine to Florida, from Florida to California and all of Mexico, next month is the beginning of hurricane season. So if COVID-19 was erased off of America tomorrow, everybody would eat all of their food, use all of their stored gas, not worry about anything, and then go, I can't believe it's hurricane season. Nobody told me. It happens every year. Every year.
Can you imagine what's going to happen if a hurricane rolls through Florida right now with the stores like they are already?
And what's going to happen with the stores? What's going to happen with the shelters?
Right. But it's one of those things.
There's no way.
That's why the three of us, Nikki, everybody here has always said, stay prepared. Get prepared and stay prepared. You have to, and listen, we're gonna come out of this. We're gonna come out of this. It's going to take some time, but we are going to get out of it. But once we get out of it, is not the time to eat all the food that you've purchased unless you just have no money. It's not the time to empty your pantries. It's not the time for you to sell every animal you bought, till up the garden, get rid of everything. You got to a new level of preparedness. Now stay there and work to build it even higher. And that's what Charlie's doing right now. Charlie has a fantastic food storage system. But what has Charlie done in this time? He's built upon it even more in different aspects. And Charlie now knows that he's more prepared than he was when we started this. So, try to take that into effect. Yes, there are going to be a ton of people that now consider, it's the same phrase of all preppers are crazy. Yeah, until something like this happens, then we're deemed pretty normal people. And actually, on the better side of things. And some people will take note of that, but it's how long they can continue to sustain that ability of living is what really makes a difference.
It's funny. It's funny how many of your friends and people and relatives that, knew what you did and those kind of ha-ha poo-poo are now calling and asking for advice and how to do things and where to get things and what they should be doing. And to me, which I'm taking the approach, which I think we all should when that occurs, not laughing at them or belittling them for never listening to you, but taking that opportunity to enlighten them to, this is why I did all that stuff. Now you get it, right? All right, let me help you get better prepared. Let's turn this into your lifestyle too, as it should be for everybody.
There's a new part of this, and the new part of that is like we talk about, this is what we've all been doing all this time. This is not new. And anybody that's ever been to a class that I've taught, I said, okay, the first thing you got to do is say, I accept my new reality. You got it, because you have to tell yourself, give yourself permission to say, okay, wait, everything has now changed, so let me give myself the freedom to adjust my thinking, how to navigate this problem.
Right.
So going forward, if we have a hurricane, it's going to be a mess. So everybody that's in a hurricane zone should be saying, if we get a hurricane, what am I going to do specifically? And how am I going to address that? Because you got the normalcy bias. We have a lot of people that are suffering from that. And we have risk homeostasis. And risk homeostasis just means that because I can wait longer before I have to get prepared because I think I can do it quicker. Now, you can't run out to the store at the last minute and buy your supplies because the supplies are already all gone. So if you're waiting now for when a hurricane shows up to go run out and buy your stuff, you're going to be in some serious trouble.
Yep.
So start thinking ahead. And the key, and John, you and I kind of muddled this around a little bit a few days ago, imagination is one of the keys of survival. You have to be able to have the imagination to say, what if, and if that happens, what am I going to do? You got to think through, because you cannot put together a contingency plan unless you can imagine what can go wrong.
Right.
Figure out all of those things and say, okay, well, what's the most likely of those to address?
I think you two should write fiction books.
We did, and now we're in a pandemic. Look what's going on.
We're living my book.
All right.
His book.
Next, and guys, one of the ways that you can be prepared is to become a Survival Dispatch Insider. It's 14 days for free. Nikki will put a link in the comments. You guys check it out. Every single month, we bring you a full editorial magazine that you can download or print off on one topic, and we have 32 back issues right now on huge range of topics. So if you're wanting to look for more information, build your survival library, check out the Insider from Survival Dispatch. You can click the link and it'll take you straight there. So, all right, continuing on here. What things should we be doing to prep for long-term effects of this pandemic?
One of the things which I think a lot of people are overlooking right now is your financial situation.
Yeah.
I would be pinching pennies till Abe screams. I'm trying to be very frugal at the moment. I live off mailbox money is what I call it. People buy books that and that's how I make my money. So I don't have to go anywhere to get it, but I'm still being very frugal with the money I have and trying to do smart things like buy fuel, food, livestock, things like that.
Yeah.
We are doing a couple of things here to make life a little nicer. Like we're going to throw a little above ground pool in. My daughter's home from school. She can't go to school right now. She's doing online school, but she's also a type 1 diabetic, so she rarely gets to leave this house. And she's getting a little bored. I don't blame her.
Yeah.
So put a pool in, give her something to do. Get outside and be able to have a little fun. And we got to remember that too. We've got to take every moment we can right now to laugh, to enjoy ourselves, to recreate as best we can, find things to do. Like we met my wife when this first started. She was smart. She was in Walmart before everybody kind of caught on because I had a little heads up and I tried to tell folks about it. And she bought a bunch of different card games and all kinds of games. So the night we were around the kitchen table playing one of the card games, and it was fun. It was great. Everybody's laughing. We're having a good time. And I think that's something people overlook and forget too.
Yeah.
Is you've got to build in a way to entertain yourself a little bit. And sitting watching Fox News or CNN or whatever your favorite flavor is all day is not going to help you.
Paul in North Carolina asks, because I'm sure a lot of people are asking this also, where are the best places to look to buy toilet paper? Toilet paper, so I'll give you it's a one-store survey, but our Publix I went into about a week or so ago. In the last month I've been there twice. It was about a week or so ago. Pretty much everything was in stock. There was rice and beans and pasta, all that came back in. The only thing that wasn't there was toilet paper. Nikki, did you see anything else that was missing?
Yeah, I went out the other day and they had toilet paper and paper towels in the store.
Yeah.
So I think they're starting to...
It's starting to trickle back. Paul, here's what I'll say. A couple places that I've seen it. Gas stations and Dollar Generals.
I was going to say Dollar Generals, yeah.
So check out those two places. Another tip, you're going to have to make the sacrifice if you can do it. you got to be at the grocery store first thing in the morning. Period. They're getting restocked at night. You got to be there first thing in the morning. So that would be what I would, what I would try to focus on. But the gas station and the Dollar General are both places that I've seen it here recently. So Zachary wants to know, do you guys think eventually this will bring back a lot of manufacturing to USA?
There's a lot of talk about that. There's a lot of people saying we should and we're gonna, but it will remain. But I mean, the capital investments to do that and the time it would take
time investment
are substantial.
Yeah.
That's a lot of money and a long time. I mean, you're not going to build a pharmaceutical plant,
right.
Over weekend. That stuff takes time. So it may happen, but it would be years. Well, I think there is the political will now.
Yeah.
When China threatened to hold back vaccine or antibiotics from us, I think people's eyes were open. Not to mention the whole world now is going, maybe we shouldn't have relied on one country to make everything.
Totally agree, but I think the other side of that is when this is all said and done, people will be like, well, we got that over with. It's just like the hurricane. 6 months after a hurricane, you can buy generators all over Craigslist because they're tired of tripping over them.
Yep.
Yeah, in a box. Yeah,
never used in a box on sale.
Yeah.
Well, they're heavy, Chris, and you gotta lift it and just leave it in the box.
I got to get a tractor to move mine.
Just leave it. Hey, Charlie. Charlie might be able to help here. Chuck wants to know what is with the miles of long lines of cars in South Florida for food handouts. Have you heard anything about?
That's where I came from. That's my old town, right? Near
Not just South Florida,
Palm Beach. Yeah, I looked at that. So Howley's Restaurant, I used to go there. So many people, if you got to look at the community, you got to look at the economy for that community. That's a very service and tourist based region.
Yeah.
You don't have any manufacturing to speak of outside of Pratt Whitney. You have a factory there, but you got nothing there other than service business. And now with people not able to go out, a lot of people are without jobs. The people that live on Palm Beach are either buttoned down or they've gone to wherever else they fly to for the rest of their other summer homes. So they're out of work, and people are trying to find where they're getting food. And this is what I was talking about earlier. People did not prepare or were unable to prepare. So we can't. Not all of us have the ability to store 3, 4, 5, 8 months worth of food. Mm-hmm. And a lot of those people did not for whatever reason or could not, and now they're in those bread lines. And back in the 1920s, we used to see the bread line. You saw the people standing on the sidewalk because the bread line was in downtown, and it was very visible. And I've said this in years past, you're not going to see the next bread lines. Well, what we are kind of seeing them, but they're cars, and now they're turned into drive-through bread lines. And a lot of times those missions, those food pantries are not in the most visible areas of the community. They're put off in more cheaper, like warehousing districts, and you're not seeing that. And now that you're starting to see it, tells me that it's even worse than what we thought. So that's why we're seeing that, is people out of work.
And you're seeing it around the country, too, because I've heard several reports of it.
Hey,
I brought this up to my county. I said, hey, right now we're already feeding 4,000 meals for kids, for our schools that have food insecurity in the county. And I brought it up. I said, hey, I'm starting to see some problems in the supply lines and all this other stuff we were just talking about.
Yep.
I think we might need to look at expanding our program a little bit for adults and the rest of our people, and maybe doing a farm-to-table initiative or somehow. And you know what my people said? I think you're right. And when the people at that level start saying, hey, we might want to start thinking about this, that's kind of that's a clue.
Yeah.
Oh, yeah.
All right, Chris, this question's for you from Alpha. He has a tumor-causing, teeth-staining, smelling, puking habit just like you do. And he wants to know, how do you have plans or backup plans to get your dip fixed long term?
No, I'm actually, this is fake dip. This isn't even real dip, and I'm getting off of it.
All right, give him some tips and tricks if he were to try to keep some longer term.
The only thing I can say is if you want to try to keep it rolling, go buy logs, man, and put them in the fridge, or the freezer, and store them up. And try to cut back,
Would vacuum sealing do anything?
Huh?
Would vacuum sealing do anything?
No. It's best to store them actually in the freezer. It makes them last longer. And put them away, store them, and learn to quit, man. I mean, I like it too. I do.
Yeah.
But I'm getting off the wagon. I'm using some fake stuff that still has nicotine in it. It's different, but I'm dealing with it, and because I need to stop. I know I need to, and I've needed to for a long time. But this time, I'm really actually committed to it because I don't run out to the store every day, and that's the thing too. This is helping me do that because before, when I'm out running around doing stuff all the time,
just stop,
and it's easy to just pop into the Circle K or the 7-Eleven and grab a can. Well, I'm not doing that now. I mean, I rarely leave my house right now. Very, very rarely. I'm going to today. I am going to run up to the Publix, drop off a prescription, but that's it.
Yeah.
That's all I'm doing. And I left for one doctor's appointment and one other time for something. I haven't been out here in like 10 days, but about 3 times. So
Jacob wants to know, do you guys see the potential for martial law?
In some areas.
We've talked about this before.
Yeah.
So Charlie and I have talked about this. I don't know if Chris was on that episode. Martial law is a term that is hard to enforce just due to the number of people. Just take, here in, say, Alachua County, we have a couple hundred police officers. Think about them trying to keep every citizen of 250, 300,000 in their house. It's not going to happen. It's too difficult. Martial law is something that a lot of people want to throw around out there, like it's a possibility, but just numbers-wise, it's almost impossible to enforce martial law beyond like what they called it quarantining, but what you kind of saw in upstate New York or right outside of Brooklyn? Where was it?
National.
But that was like
that
was like a 1 mile radius. Okay, I mean, extremely small area. But when you start expanding that region to a city, a county, things like state, it gets to be almost impossible. Any other thing you guys want to add there quickly?
Well, yeah, and here's this is again from my buddy in the NYPD. There are currently 7,000 officers out.
Yeah.
Because of COVID-19. There's another 1,000 working from home.
Yesterday.
Well, they're not publishing the numbers anymore publicly. They stopped that. He said it's about 18% of the force is currently out of work. And they stopped publishing sick numbers in the paper. They were doing that, and they've now stopped.
Yeah.
So that's where they're at presently. And that's coming from him. He's one of the guys working from home because he has some respiratory issues from 9/11. He was one of the officers on the ground there, spent so much time, helping out that he's got respiratory problems too. And as a result of that, he works from home. Plus, he's a supervisor, and he's not a beat cop. But yeah, when you start looking at, this stuff can affect everybody. Firefighters, because they're first responders, they're showing up to calls and stuff, and paramedics and nurses. There's the Detroit hospital system, I think it is, has 700 nurses and doctors that are COVID positive. I mean, these numbers are enormous. So same thing happens with law enforcement. In the military, we all saw what happened on the Theodore Roosevelt. They flew, 300 odd sailors off of there with COVID-19?
2,700 they're trying to get off the ship.
2,700. And see, so out of a crew of 5,000, give or take, probably?
Right.
It's over half of the crew.
Yeah, it takes the ship down almost out of, combat status, which could lead to problems with South China Sea, with the geopolitical situation ramping up with China. Yeah, it's Taiwan.
Oh, yeah.
Yeah. So there's a few other things going on there.
All right, if they let people that have been infected and are healthy to go back to work, what happens if they get reinfected and are out working pre-symptomatic in public before the second wave hits? Charlie?
Yep. Yeah, they'd be the cause of the second wave.
Yeah.
And it does happen.
That's going to be the problem. Because trying to get everybody locked down the first time is one thing. Trying to get them locked down the second time,
What was that, Charlie?
Good luck.
All right.
I'm glad we have fun with this.
If we can get that to scroll up here. All right. Do you think COVID-19 is blown out of proportion just by the means of those in power to further their agendas, trade, liberty, and security?
Say again?
Do you think COVID-19 is blown out of proportion just as a means of those in power to further their agendas?
First of all, we give people a lot of credit, and I think sometimes we give them too much credit. I lean towards incompetence a little bit more than conspiracy a lot of times.
Yeah.
So, but
I mean, because you got to think, how is this furthering anybody's agenda? I mean, there's only one guy in the whole world. There's only one guy in the whole world whose agenda may be furthered by this. I'm not going to get into the conspiracy side, huh?
Bill Gates. Well, see, it's a lot of people seem to look at the Bill Gates last video he did, his TED Connect talk, where he talked about we can't let enough people get sick yet because we have to create a vaccine. And we don't want it in the wild and try to do it transfusion-wise because there's a lot of money to be made for vaccines. I think what you'll find is a lot of people will take advantage of the situation, not let the crisis go to waste, but you do have a lot of incompetence that's caused the situation in the first place.
Yep.
I agree.
Yep.
All right. Chris wants to know, what would you all recommend as a replacement to Lysol? I would say a bleach solution to begin with.
Yeah,
watered down bleach solution.
And if you go, Nikki, I think can probably put a link up. I think it's Clorox.com or somebody. They have a sample of like every type of bleach they make and what the ratio is. It's a cap full to a liter or blah blah blah. But that's one way. Chris,
I got a good one for you too that a lot of people don't think about. Dawn dish soap.
Yeah.
Dawn dish soap is antiviral.
Yep.
Antibacterial, anti-everything. And their website, same thing. They will tell you how to dilute it into spray, and you can use that as a surface cleaner.
Yep.
Whatever. It's very effective for the same thing, and you can generally find Dawn dish soap.
Yeah, I have like a big bottle of palm olive that I've been using just to wash my hands. Yes, it'll dry out your hands some. It's okay, but that's what I've been using, and I've been using it since pretty much day one. And it takes such a small amount. I mean, the size of like your fingernail. That's all you need, and it works.
The Dawn Platinum is what I get. The Dawn Platinum concentrate from Costco, because you can use a drop of that. It's very effective. It expands quite a bit. And regular hot soapy water does perfect on cleaning everything for this particular virus.
I agree.
So, and that's also why we store liquid bleach, all the time too, so we can use it for all these things.
All right, we're going to do some yes or no questions here, okay? So you get yes or no. You guys both understand.
I don't know if I can do it.
See, I knew you couldn't even just say yes or no. Gosh.
Yes.
All right. Do you think the economy is fixing to take another hit in the coming weeks as supply lines readjust and the unemployment climbs?
Yes. No.
Yes. Nikki.
Partial.
Wow.
Not as big as it was before, but I think it's going to continue to kind of tumble.
I think we have not yet begun to see the effects to the economy what we're going
market.
Wow, now that we're doing rebuttals here, okay, Charlie, you get your rebuttal since Chris gave his.
Did you say the markets or the economy?
The economy.
I think the economy's in trouble.
Yeah.
I think the markets are going to start baking it in, though.
Yep. I mean, they had a huge adjustment yesterday. 10% adjustment yesterday. All right. Can COVID-19 be contracted from petting an animal?
Yes.
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 All right, 4 yeses. Finally, we agreed. It only took us about 4 years. Gosh. All right. Paul wants to know, in case the communications go down, is ham license a good idea for everyone to get now?
Yes.
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 And you can do it online.
Yes.
Yeah, they're working on the online part of that too.
Yeah, all right. Do you think ammo will become scarce and very expensive after the COVID-19 situation?
It already is. Yes.
Yes.
From a person that works in the firearms industry, yes. Companies like Federal have already come out and said that in order to bring on more workforce and the cost of materials going up, every box of ammo that Federal produces now is going up 6 to 10%. So when it goes up 6 to 10%, that gets passed on to you, even when it comes through our store. It's already been stated in letters from their president. So I'm not making this stuff up. What are your plans? Joey wants to know, what are your plans with the stimulus money?
Yes.
Yes.
Am I going to get it? No.
No. No. No.
Never going to see it.
I'm trying to get taxes filed so that I can maybe get that money before they give it to somebody else.
I applied for the SBA grants for my companies, and I doubt they're going to give those.
Do you see his
I don't think they're going to get
video? Is it your end?
No, it's something with his connection.
Oh, okay. All right. Has there been a rush to buy firearms? Haven't heard any. Yes, firearms, as far as self-defense pistols go, are very, very hard to find. You'll be lucky if you'll find anything that says the word Glock on it anywhere. There's been a huge run. Ammunition for 9mm, 223, like that is pretty much,
I found one.
Extremely hard to find. And then magazines are also taking a huge hit as well. All right, next question. Can you use pool shock for non-drinking disinfectants?
Yes.
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 All right, we got 4 yeses again. So just make sure that you're making a good solution when it comes to that. Is bleach harmful to your lungs?
Very.
Yes. Very much so.
Yes.
And damn sure keep it away from ammonia.
Yeah, especially if it's in the powder form. So like pool shock and stuff. That's why when you open the bag, you usually lose consciousness. All right, with all the money spent on panic buying, Albany wants to know, with all the money spent on panic buying, how is this hurting the market? Charlie.
It's hurting the market because it's straining the supply lines and it's causing price increases, and it's just causing shocks to the system. So these are things that if you slowly prepared for, then we wouldn't be putting such a strain on the system, causing so much disruption and expense.
Chris, you want to add anything to that?
Oh, what was the question again? Sorry, I'm getting a million text messages.
No, with all the money being spent on panic buying, how is it hurting the market?
Well, like Charlie said, it's just stretching supplies. I mean, people are panic buying, but now there's nothing to buy, so everybody's waiting. And with the disruptions in supply that we're going to see, there's going to be even less to buy. Hate to be the bearer of bad news, folks, but that's what's coming.
Yeah. Pog wants to know, is 380 ammo, pistol ammunition, hard to come by also? For the most part, it is hard to come by. You'll find some Target boxes now and then, like 50, but self-defense boxes are very, very hard to come by. So, all right.
John, have you heard that the Remington ammo plant is shut down?
So there's been mixed reports on that. Remington, as a company, is going through a lot of closure. They've gotten rid of companies like DPMS. They've shut down a lot. Vista Group is who owns that, and so they're getting rid. They got rid of Bushmaster. I think Bushmaster, DPMS, and a couple others. So there have been some closures at Remington. I haven't heard much about the ammo yet, but I can look into that. So, all right.
It's a message I got.
It is 4:10. We're going to take 5 more minutes. Charlie, closing thoughts here.
Closing thoughts, I would say continue to build your plans. This is not going to get better anytime soon. This could stretch out all the way through next year. This is going to turn into a community disease. So stretch out and do your tiered food storage. Be as self-sufficient and self-reliant as you can, because I think that don't get hurt right now because you don't want to go to the hospital, and don't go to the hospital if you don't need to go to the hospital. The free rides and the people that jump ambulances are way down in our county right now, so that's good. And just all you can do is stay home and try not to strangle each other.
Yeah. Chris, closing words.
Sorry, more text there. Yeah. it's kind of like Charlie said, focus on, well, it's stuff about Remington. I'm reading it, I would continue to prepare as best you can and start thinking long term, folks. We should have been planning long term. Anybody watching this should, you guys probably already were, but continue to think very long term. Don't look at this as ending at the end of the month or, the end of next month. Like Charlie said, this will absolutely, in my opinion, go into next year. We're going to see the second, third waves, fourth potential wave even. And we're just beginning to see the second and third order effects of this thing to what it's doing to society as a whole. Yeah. Travel closures, states not letting, like in Florida, we have roadblocks on I-10 catching people coming out of Louisiana. We've got them up north catching people coming out of New York, Pennsylvania area. So many private jets were flown into the Palm Beach area, they had a problem parking the damn things. So people are still trying to move, and we really kind of need to stay put and do the best you can to plan and get creative. The grocery store may not have what you're looking for. Hit the damn dollar store. Go look. May not be the brands you want, but you can still get some stuff. Some of the lower end grocery stores, I hate to use that phrase, but like Save A Lot, those kind of places, hit those up. They're going to have stuff. Yeah. Get creative and start putting it away.
Groceries, seeds.
Well, yeah, and seeing like the thing with some of the states saying they were considered non-essential and they weren't to be sold. I'm hearing too that like Home Depots are taping off certain aisles and Walmart's actually taping off aisles because people are going there and just wandering around to get out of their houses. We don't need to be doing that. Yeah. If you're bored at home and you need to get outside, go take a walk around your damn house if that's all you can do. Yeah. I've got the luxury. I live out in the boonies on 10 acres here on a dirt road, and if I feel like going outside, I can. But, find ways to entertain and recreate yourself, work out, for everybody, if you're stuck in the house, push-ups, sit-ups, all that good stuff. Not that I'm doing that. Don't get me wrong, but I'm not bored yet. I have too much crap to do. So, but you've got to think through all of this stuff. You've got to take care of the mental side as much as you got to take care of the physical side, guys. And financially, you start preparing now because it's going to get ugly.
Yeah, and I'll close with this. Camper has a question here. Where to get seeds? They seem hard to find right now. Kind of like what Chris was saying. Instead of going to large grocery stores for food, start to look at those smaller ones. Camper, I would say like a lot of Home Depots, a lot of Lowe's have been hit really hard. Try to go find like those Ace Hardware stores, True Values, Tractor Supplies.
Rural stores.
Yeah.
Local feed stores.
And even there's these things called nurseries. Inside of nurseries, they actually have a lot of seeds. And it's one of the things, Nikki and I around here, just down the road about 10 miles, we have like 5 or 6 nurseries. And they sell, huge orange trees and things like that. But they also sell seeds and stuff. So go check out nurseries also. They get overlooked quite a bit. And, and I would say, hang in there, stay positive, keep yourself mentally busy. Now is a great time to go through your preps, organize your preps, inventory of them, and see really where you stand, and listen, go through your preps. If there's crap that you haven't used in a couple of years and you don't use it anymore, try to sell it. Sell it, get rid of it, and use that money to buy something that you need at this time.
Or barter it off.
Barter it, yeah.
Great opportunity for that
the barter websites have seen a massive increase in traffic. So you can go online.
Facebook Marketplace, places like that,
Yeah, look for, there's some barter websites. There's like barter clubs that can do stuff on there, and you can work for credits to
I love how I didn't talk during your guys' closing, but then you guys just jump all in mine. That's just, wow. I really appreciate it.
We were having a sidebar.
I need a mute button, Nikki, so I can just mute them. Sheesh.
Well,
Oh, I can
John,
make
we're
that
already talking to you. Are you saying something?
I
right.
didn't ask. Did you ask?
All
I
right,
didn't ask.
last question here, and then we're going to get out of here. So Nicole wants to know, besides food, is there any possibility of power shortage, internet shutdown, water scarcity when things get worse for long term? You got 30 seconds, Chris.
The only way that would happen is if so much of society was down that they couldn't actually operate those facilities. They're going to try very, very hard to keep power, water, internet, and cell phones up because that keeps people at home. So those will be, if those go down, it's kind of Mad Max world at that point.
Yeah, Charlie, 30 seconds.
30 seconds. I have my 30 seconds.
I'm giving you an additional 30 seconds. Consider this a grace period.
Find some breeding pair of rabbits. Start thinking about your protein production. Start working on getting healthy. Don't sit around the house. No, not for him. Don't just sit around the house. Get outside, get some air. Don't let your dog pet other people. That kind
There
of
you
thing.
go. Nikki?
Don't let your dog pet other people?
Nikki?
So I finally woke him up.
All right, I'm meeting them. My thing would be for everybody that's at home, whether they're with kids at home or working from home or that kind of thing, try to schedule out your day.
Sounds like Charlie Brown's teacher.
Don't just, sit there on the couch and watch the news all day, because that'll go down that dark rabbit hole all day long, and there's no coming out of it.
Yeah.
Schedule a time. All right, I'm gonna look at the news first thing in the morning, and then in the evening, and then I'm gonna have some time to go out and ride the bike with the kids and be active, and then I'm gonna get some time to do some work.
Yeah.
Schedule things out, because if you just focus on the news, whatnot, you'll be down it all day long.
Yeah, I agree. So guys, I hope you really enjoyed this video. Make sure you hit that like button. It really helps us reach. We are so close to 100,000 subscribers. We are 2,000 subscribers away from that.
Well, let me subscribe quick.
That's ridiculous. If Chris would have subscribed, he would have already been there. But we think
Tell your family, tell your friends.
Yeah, we thank each and every one of you. We hope you guys were able to get some good information out of this. We hope that you guys are safe in this time. If you have any questions, always feel free to hit us up at Survival Dispatch here on YouTube, on Facebook, and on Instagram. Make sure you follow us there as well. Us three knuckleheads and Nikki and all of the writers that work for us. We have over 17 people that are a part of the Survival Dispatch community as far as writers and contributors. We all take our knowledge from all around America and different walks of life, and we bring it to Survival Dispatch. So make sure you're following us on those social media channels also, because we try to put as much current and useful information on there as possible. Also, make sure you check out the Survival Dispatch Insider. I hope you guys have a fantastic week. I hope you guys are safe. And until next time, have a great day.